When I do an open approach to rhinoplasty, I like the stair-step columellar incision. It's in the mid portion of the columella and comes down, which is in the area that's most adherent, and then it comes just behind the lateral columellar flare and then upward, and we'll do that bilaterally. And then what I'll do is we'll extend it along the infracartilaginous border along here, and we'll do the same on this side, just inside the fimbriae. So with a wide double hook, I incise the mid-columellar area to lateral and up into the soft triangle, and then usually the width is a blade width. Inferior laterally, extending along here. I like to go down, as you can see, I like to go all the way down to the cartilages, and with tension countertension that just pulls that apart. And then I will make the lateral incisions, infracartilaginous incisions, really letting the blade just feel the edge of the lower lateral in that area. Do that bilaterally. You can just feel the edge of your cartilage. Then the dissection is carried out from inferior to superior, and it's a pushing, cutting method that allows you to push up, especially in primaries. You can do this. In secondaries, it's obviously a lot more difficult because you have to sometimes use your knife. We push up, and then once I've got it just below the infratip lobular area, I'll dab again, make sure that's dry, and then what I'll do is, and again in primaries, I will now go in and spread parallel to the lower lateral cartilage interface, and the key is to stay right on that cartilage. And in a primary rhinoplasty, as you can see right here, you can spread into this area, and that really allows you to get into the right plane. And then the key maneuver here is to go behind the soft tissue triangle, spread, and then connect the dots between your lateral infracartilaginous incision and hugging. What I'm doing here is I'm really hugging the edge of the cartilage. So I can feel it. So I'm hugging that. And then by allowing me to do that, I can connect those edges. And that then allows me to spread. That allows me to pull this down and prevents me from dinging the lower lateral cartilage, which I think is very important. This is the key maneuver in doing an open rhinoplasty, is to get behind the soft tissue triangle in an atraumatic fashion. So when I just leave that there, and do the same on the other side.